Hello everyone, it's Sally here, Strength for Dance, and today we're going to be looking at rising. Now, this is a really important exercise. We use this a lot in clinic, and I think rising is pretty much used in most forms of dancing. So it's very important to get some good technique down. Now, we have Sammy's legs here, who we will meet later. And the first thing we're going to be looking at with our rising is starting position. So making sure that we're in tripod foot alignment and that the knee is soft. So you'll see I just corrected Sammy's knee there because she was a little bit hyperextended like many dancers. When we are hyperextended, it will change the relationship here at the ankle and put it into more of a pointed position. But we want to start in neutral. So when we're looking at a double leg rise, there's a knobbly bit of bone here that's called navicular, and we want to think about lifting from navicular, coming up nice and even until we find our full height. Now she has a nice high range here, and at the end of the rise you might notice that navicular just turns this way a little bit, and we just have a sort of little peekaboo moment here at the back in the heel as the heel tilts into what's called inversion, and then we want to slowly lower down again. So just as a recap, we want to lift up nice and level. And then right at the end, we get this nice sort of little screw home mechanism as we lock into the height of the rise. And this end locking in motion as well, we get this activation coming up the back of the calf with tibialis posterior. And when you get your full height, you do have a really nice sensation of just sitting on top of a shelf. The other thing to look for when we're up in our rise height is even weight-bearing distribution between toes 1 and 4. Remember, that toe 2 is still our center point, just as it is on the floor. So when we're in a rise, we want to be stacked with a neutral ankle. So we don't want to be fishing. I know it might look pretty with the leg in the air, but it's not good for a weight-bearing surface on the floor. And we don't want to be sickled out towards the side. So we want to come up, middle ankle, and a nice long line running all the way down the shin towards toe 2. And then back down again. Now, if you are prone to sickling or fishing, we can then use the band to help train. So I'm very lucky, I've got my nice Harlequin band here, and we're going to wrap it around the ankle. So I'm just going to tuck it a little bit behind the heel as well, and pull it here. Now I would have this attached onto something secure like a bedpost or chair, or if you want to, you can knot it and close it in the door so it's nice and firm. And then as we rise up with very gentle force against the band, we're going to come up and just connect in, and that will just fire up our proprioceptive feedback and give us a better sense of awareness. Now I would be using this band if I'm prone to sickling, so that then I can pull in against it and find a neutral position. And then lower back down again with our centered foot. Now, if we do have it slightly underneath the heel, like that, you can almost then work up that navicular bone against the line of the band. So we're coming up like this, connecting against the band, and then down again. Now, in reverse, if you have a tendency to be fishing, I then just pop the band around on this side of the ankle. Actually, I'll put you like that. So we come up and we just have a little bit of guidance and pressure on the outside of the ankle. So again, if I'm normally fishing in, I can then just push back against the band, find my center, and then lower down again. So this is positional retraining with a little bit of extra feedback through the skin, through the proprioceptors, and helping the muscles find that sort of horse reins guidance that they need to keep the ankle centered. Another nice way to train our double leg rises so that we can feel a good foot setup position and get that nice early recruitment of tibialis posterior is to use a ball. Now I've just got a tennis ball here, but you might have a small spiky ball or one of your yoga tune-up balls, your nice tacky balls. And from here we're going to come up, pressing down towards the big toe joint and hold on to the ball. Now you can see here as well, as she's in her rise height, towards the end of her motion, her heels both tilt in, and that is inversion of the heel. And we are looking for that at the end of rise because this is a passive windlass mechanism and it is supination at the end of this position. Come down. Don't forget, you can look at the other foot videos if you want a little recap on foot motion. So once again, connecting in with the ball, holding it, coming up centered, and then right towards the end, we have that work on tibialis posterior, inversion of the heel, and coming down. The other nice thing about working with the ball here is that you can get really good connection through your first toe joint or your first met head. If you just turn around again for us, and we'll actually look at it from this angle. So squeezing the heels in, feet parallel, if we can, second toe running as center, and we come up. And you can see it encourages her to actually connect with her first toe joint through the floor. While she's up there, another little note here, guys, long toes. These toes are beautifully long here. We want to avoid seeing scrunching on the floor and grabbing onto the mat. That again, if we're doing that too much, can lead to irritation in the long toe flexors that run at the back of the shin and on the inside of the ankle here. Coming back down again. And we're just going to target a slightly different muscle group now by doing some rises with a bent knee. So we're going to be focusing on the lower muscle group here, which is soleus. Those other rises, we were working on gastroc here and the two big bellies on the side. So if we bend the knees here, and again, it's the same kind of cueing. So we want to be lifting from here, not rolling through the foot, but we're going to rise up to our full height. Again, just looking for that. And you can see the heels aren't quite the same here on Sammy. So that's something that I'd probably want to look at a little bit treatment-wise, and then come back down again. So if she carries on with this, when we're looking for our rises, if we're doing a pre-point assessment, we want to be looking for about 20 single leg rises. And then this just consistently increases as you become older and stronger as a dancer, up to about 30 single leg rises if you are looking to be full-time or professional. This would be the same with your bent knee rises also. So if you just come onto one leg for me, and then work on a single leg bent knee rise, and then down. And then we'll look at the straight leg, single leg rise, coming all the way up again and then down. I feel you just need to pop onto your big toe a smidge more on that side. There we go, better. Now, before you progress onto a single leg rise, you can do what's called a double leg rise with transfer to lower. Nice big words. So we're going to come up on two legs, transfer slowly onto one side, and then slowly lower. 2 feet down, coming up, transfer over and down on the other side. Now, the slower we come down, the more we're going to bias eccentric muscle control. You can even do this over a step, and so the heel can drop down a little bit lower over the step. Eccentric muscle training is really good for building strength and resiliency within the tissues, tendons, and the muscle. And it can also help with range. So rather than spending all your time in a static calf stretch, you can do some eccentric heel lowers, some eccentric heel lowers, and you can increase range at your ankle. So this next exercise, we're going to just look at a double leg rise, transfer onto one, lower down and come into a fondue. And then onto the other side. So we have 2 up, transfer, lower, fondue. This is quite a nice rise exercise to look at preparing you for landing from jumps. Make sure though that you have looked at good pronation technique for that landing motion as well in your foot. Good. The final thing we're going to look at are sustained holds. And we would often use these early on in a tendon loading program. So if somebody was starting to get some symptoms at the back, or if they did have a diagnosis of tendon pathology, we would sometimes start with isometric work. That literally means sustained holds. So we would take it up maybe to 1/3 of our height, and hold for about a count of 10. Then we can actually go up a little higher, 2/3 height, hold for 10, and then come back down again. Now, when you're doing this at home, you just want to make sure this is a pain-free exercise, but it's always good to be able to train in an isometric manner, so with no movement involved, as it helps to create tension within the tendons. Our tissues respond to tension and stress, so that's a positive response. You can do the same exercise with bent knees. So she comes up and holds mid-range, maybe 2/3 range, and then comes back down. And then you can do it all again on a single leg. So if we just do the straight leg version, we just ride up, holding 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, rising up again, 10, 9, 8, 7, 6, obviously you would count normally, and then come back down. And maybe looking about 10 repetitions of 10-second holds. And that's a nice rise exercise to look at tensioning the tendons and the connective tissue. So in summary, we have looked at rise position, making sure we have a neutral ankle, a nice equal weight bearing platform, and long toes. We're looking at trying to get to our maximal height and being able to stay there then when we transition onto one foot. We've looked at doing rises with the band and the ball to help with our technique and alignment. And we've also looked at training the deep calf with doing our rises with a bent knee. When you're doing these kind of exercises, you want to be looking at technique first, always making sure you have good form, and then you can increase the volume. You might also get a better response if you do a little bit of ball releasing first into the back of the calf. I hope you enjoyed this series, and I'll see you again soon. It's bye from me, and bye from Sammy's legs.